In the interest of time, I'd like to now introduce Anita Weinberg, clinical professor and director of the Civitas ChildLaw Policy Institute. For over 10 years, Anita and her students were intensely involved in efforts to eliminate childhood lead poisoning in Chicago and Illinois. Their work included raising awareness, building collaboration among stakeholders, and policy and legislative reforms as part of the Illinois Lead Safe Initiative. In addition to being a subject matter expert, she is a longtime advocate for children's health and children's rights. Anita, thank you.
Thanks, Catherine. Good morning, and thank you all for being here. Can you hear me? Yep, okay. Thanks for being here. The horrifying details of how an entirely preventable crisis evolved in Flint, Michigan, the series of Tribune articles over the last year and a half, the Health Justice Project at Loyola's petition to HUD regarding lead hazards and subsidized housing, have all helped to bring renewed attention to the problem of lead poisoning in the Chicago metropolitan area, and really raise questions about what do we know about what's happening in our region. Many in this room have been working to eliminate lead poisoning and make homes healthier for decades. And we've made tremendous strides, the truth of the matter is. In the 60s, newspaper headlines cried out that children were actually dying from lead poisoning, from lead paint poisoning. Tens of thousands of children were being poisoned at high levels. Today in this country, it's rare to read about a death related to lead in paint or lead in water. It has more to do when a child swallows a metal. Awareness has helped, education has helped, federal laws and regulations have helped, old buildings being raised or gutted and renovated has helped, and some innovative projects and programs to address lead hazards has helped, including one related to replacing windows, and one of the authors of a study on one of those projects, Dave Jacobs, is one of our speakers today. So there's been a lot of movement, but we have a long way to go, and today we face a different challenge. We know through research, again, one of our partners, Ann Evans, some of her research and other colleagues of hers, and other national experts across the country, we know that children are being harmed at much lower levels of lead in their system than was once understood. And while children in poor families were always at greater risk, it's even more so now. In the Chicago metropolitan region, that means families of color are carrying the burden of our old and poorly maintained housing and old infrastructures. With the awareness of the hazards of lead, families with resources are able to make the efforts needed to prevent their children from becoming lead poisoned. And if poisoned, they tend to have the supports needed to ameliorate those harms. Not so in poorer communities of color. You're going to be hearing a lot more about this as the morning goes on. Everyone here shares two principles. One, children should not be exposed to lead. And two, if they are exposed, we need to ensure that their families have the supports and resources needed to mitigate the harm caused by those sources of lead. There may be differing views in the room on the best ways to accomplish this, but we're all working toward the same goal. Today's goal is to take a collective look at what we know about lead poisoning in our communities, lead in paint, lead in water, in pipes, what's being done to respond to that problem, and what more needs to be done. We want to thank the city and county public health departments for helping us to set out the landscape to find out what is going on in our area and current responses and the strengths and weaknesses in those responses, and to the national experts who are here this morning to provide an overview of why I care about lead poisoning in the first place, and then also insight in what is happening on the national scale and what more needs to be done here and elsewhere. We want to thank our co-sponsors for helping with the event today, Great Lakes Center for Children's Environmental Health at UIC, Health and Medicine Policy Research Group, Illinois PIRG, Lurie Children's Hospital, Physicians for Social Responsibility, and the Public Health Institute at Loyola University. We have a tight schedule, as Catherine alluded to, and lots of information in a short time. I think many of us would prefer to be sitting around round tables having discussions focused on what do we know and what can we do. But today is really focused primarily on just gathering information. Our hope is that with this information, there will be further discussion and action will follow. Because of the tight schedule, our Speakers, we're going to only be providing very brief introductions. Please look in your folders for more information about them. And also during the Q&A, which will be almost at the end of our program this morning, we have note cards in your folders. During the break and in between speakers after the break, you can be writing down questions. People will be collecting them. Look for folks wandering through the aisles, and we'll be taking in those cards and providing them to the moderator who's going to be facilitating the Q&A